Every 33 seconds, someone in the world dies from a heart attack. This figure is not just a cold statistic. The next person could be a father, a mother, a friend, or even ourselves on an unannounced day. Imagine our heart as a lush green garden and the coronary arteries as the irrigation system delivering oxygen-rich blood to nourish every plant, every patch of soil that is every heart muscle cell. Over many years, due to diet and lifestyle, atherosclerotic plaques filled with cholesterol and other fats begin to form, gradually narrowing the artery lumen. And then a sudden event occurs. A plaque ruptures. Immediately, the body reacts by sending platelets and blood clotting factors to patch the wound, forming a blood clot. Unfortunately, this blood clot grows too rapidly, and in an instant, it completely blocks the artery lumen. The water pipe is completely shut off. This is the moment a heart attack begins, and the 70-minute clock starts ticking. From the very first seconds, a battle for survival unfolds within your chest. From minute 0 to minute 20. The golden window. When blood flow is cut off, the heart muscle cells in the affected area immediately enter a state of ischemia. They are like trees deprived of water. They stop functioning, stop contracting, but they are still alive. They are in a state of shock and awaiting rescue. If we can restore blood flow during this phase, the garden has a chance for almost complete recovery. This is crucial for heart attack recovery and minimizing heart damage. From minute 20 to minute 40. The destruction begins. After about 20 minutes of oxygen deprivation, the first cells begin to die. The irreversible process of necrosis officially starts. A wave of death begins to spread from the innermost layer of the heart wall outwards. At this point, the first permanent damage has appeared. The patient's symptoms often become much more intense and apparent. This highlights the urgency in cardiovascular emergencies. From minute 40 to minute 70. Accelerated necrosis phase. This is an extremely critical stage. The rate of heart muscle cell death escalates dramatically. A significant area of myocardium is undergoing necrosis. Medical intervention at this time is still vital, as it can save a portion of the half-dead heart muscle on the outer edge of the damaged area. Your actions at this moment will determine the eventual size of the scar on the heart. That is precisely why the 70-minute window is emphasized. It is a critical threshold. After this time frame, the ability to salvage heart muscle cells drastically diminishes, and the fate of most of the affected myocardial region is sealed. The entire emergency medical services system, from ambulances to hospitals, is designed to race against these 70 minutes with a single goal to restore blood flow as soon as possible, saving every heart cell. This highlights the importance of timely medical intervention for cardiovascular disease. So what happens if you miss that golden 70-minute window? Frankly speaking, your heart will suffer permanent damage. Imagine it this way. First, your heart will weaken, losing its ability to work effectively. This is known as heart failure. The dead heart muscle tissue cannot regenerate. It will turn into a stiff, non-contractile scar tissue. Your heart will then be like a car with a damaged engine. It still runs, but very weakly and sluggishly. Your quality of life will change completely. Climbing a single flight of stairs will leave you breathless. Walking a short distance will leave you utterly exhausted. Your legs may swell due to your heart's inability to pump blood effectively. You will have to live with this condition for the rest of your life. This is a common outcome in advanced cardiovascular disease. Secondly, your heart rhythm can become irregular, beating erratically and very dangerously. The scar tissue in the heart can cause electrical shorts, leading to the heart suddenly beating chaotically and then stopping completely. This can cause sudden cardiac arrest at any time, even while you are asleep. Many people need to have a pacemaker or implantable cardioverter defibrillator ICD implanted to prevent this risk. Thirdly, the worst-case scenario. The heart can rupture or perforate. When heart muscle dies and weakens to the point of being unable to withstand pressure, it can rupture. This is an extremely dangerous and almost untreatable complication. In summary, delaying beyond 70 minutes means accepting a heart full of scars, weakened and prone to malfunctions at any time. This is a steep price, especially when we can completely prevent it by acting correctly and quickly from the outset. This emphasizes the importance of early intervention in cardiovascular disease. When the clock ticks past the 70th minute without effective medical intervention, the battle doesn't end. It merely transitions to a new phase, one of permanent losses and long-term struggles with illness. Missing the golden window will leave indelible consequences, completely transforming the patient's life. Firstly, and most commonly, myocardial scarring leads to chronic heart failure. The area of heart muscle that died from lack of blood will never regenerate. Instead, the body will replace it with scar tissue, a type of rigid fibrous tissue incapable of contraction. When a part of the engine becomes scarred, the overall pumping strength of the entire heart will be permanently weakened. The heart becomes a feeble machine, no longer strong enough to effectively pump blood throughout the body. Consequently, the patient's life will be tied to debilitating symptoms. Shortness of breath, even with mild exertion like walking or climbing stairs, persistent fatigue, swollen legs, edema, and sleepless nights due to dry coughs. The quality of life significantly declines. Next is the risk of facing dangerous heart rhythm disorders. The scar tissue in the heart not only weakens its pumping ability, but also disrupts the heart's intricate electrical conduction system, causing deadly electrical shorts. Episodes of arrhythmias like ventricular tachycardia or ventricular fibrillation can occur suddenly, causing the heart to stop beating and leading to sudden cardiac death at any moment. To prevent this tragedy, many patients are forced to live with an implantable cardioverter defibrillator, ICD, permanently placed in their chest. In more severe cases, when the area of necrotic heart muscle is too large, the heart wall can become so weak that acute mechanical complications occur. These are medical catastrophes such as ventricular septal rupture, papillary muscle rupture, leading to valve issues, or even heart rupture. Most of these complications are extremely serious with very high mortality rates even with emergency care. Finally, a damaged heart will never be as healthy as it once was. It will be weaker and more susceptible to future heart attacks, increasing the risk of recurrence and mortality. The mortality rate in subsequent years for those who received late emergency care is significantly higher than for those who arrived at the hospital in time. In summary, the overall picture is truly frightening. Missing the golden 70-minute window is not just losing a part of the heart muscle, but the beginning of a cascade of debilitating, costly, and life-threatening health problems, leaving a burden on both the patient and their family. This underscores the profound impact of cardiovascular disease. We've seen the devastating consequences of delay. Now comes the most crucial part, the decisive weapon that will help you and your loved ones win this race against death. Knowledge is power, and a clear action plan in your mind is the compass guiding you through the storm. Equip yourself with knowledge, recognize the warning signs. Before you can act, you must recognize the enemy. A heart attack doesn't always look like it does in movies. Memorize the symptoms, both classic and atypical, because they can save your life. This is key to heart attack prevention and early detection. Classic symptoms. These are the most common signs we usually hear about. It's a squeezing pain or a feeling of heavy pressure, tightness, or a crushing sensation in the center of the chest. This pain can last for several minutes or come and go. This discomfort is not limited to the chest, but can also radiate to the shoulder, neck, jaw, back, or especially the left arm. Atypical symptoms, extremely important. This is the part most often overlooked, leading to unfortunate delays. Many people, especially women, the elderly, and diabetics, can experience a heart attack without clear chest pain. Instead, they may experience sudden shortness of breath, feeling breathless, unable to get enough air even without exertion. Unexplained fatigue, a sudden and extreme feeling of exhaustion completely different from normal tiredness. Nausea or vomiting, a queasy, uncomfortable feeling in the stomach. Epigastric pain, pain in the upper abdomen just below the breastbone, easily mistaken for indigestion or an upset stomach. Dizziness, lightheadedness, feeling faint or about to pass out. Cold sweat, suddenly breaking out in a sweat even when not hot or exercising. Always remember the golden rule. Never ignore any unusual symptoms that appear suddenly in the area from the navel upward. When you or someone around you experiences these signs, do not panic. Take a deep breath and precisely follow the next 5 steps. Each step is a crucial link in the chain of life-saving actions. Step 1. Call 911. Immediately the most important action. This is a command, not an option. The moment you suspect a heart attack, the first and only action you need to take is to pick up the phone and call 911 emergency services. The reason is that the paramedic team is not merely a means of transport. They bring a mobile emergency room directly to you. They are equipped with a defibrillator to handle cardiac arrest oxygen, to support breathing, necessary emergency medications, and can perform an ECG electrocardiogram en route for diagnosis and to send information to the hospital. Based on this, they will take you to the most suitable hospital capable of rapid coronary intervention. Avoid these deadly mistakes. Absolutely do not drive yourself to the hospital. You could faint or your condition could suddenly worsen while driving, endangering yourself and others. Do not wait to see if symptoms will pass. Every minute of waiting means more heart muscle is dying. Do not have family members transport you by motorcycle. This is an unsafe means of transport, lacks medical equipment, and can worsen the patient's condition. Step 2. Stop all activity. Stay calm and rest. While waiting for the ambulance, minimize the burden on your heart. Immediately stop all ongoing activities and sit or lie down. The best position is a semi-reclined sitting position. Fowler's position, leaning against a wall or chair with knees slightly bent. This position helps relax the chest and makes it easier to breathe. Loosen any tight clothing ties or belts. Try to stay calm and breathe deeply and slowly. Panic will make your heart beat faster and consume more oxygen, worsening the situation. Step 3. Chew 1-325 mg. Aspirin. If available. If available and the patient is not allergic, give them a 325 ml dose of aspirin. Aspirin works by preventing platelet aggregation, thereby helping to slow the formation of a blood clot or prevent it from growing larger. The correct way to take it is to chew the tablet thoroughly, not swallow it with water. Chewing helps the medication absorb quickly through the mucous membranes under the tongue and into the bloodstream almost immediately. Important note: absolutely do not use aspirin if you know the patient is allergic to it, or if they have bleeding conditions such as a bleeding peptic ulcer. Step 4. Do not self-medicate with other drugs. Aside from aspirin, Absolutely do not take or administer any other medication on your own, especially unverified or unprescribed heart-aiding remedies. Many vasodilator drugs can cause a sudden drop in blood pressure, reducing blood flow to the heart and exacerbating the heart attack. Leave medication administration to medical professionals. Step 5. Be ready for the emergency team. Small actions while waiting can save valuable time when the emergency team arrives. If possible, ask someone to open the door, clear pathways to facilitate the movement of the stretcher. Have all the medications the patient is currently taking daily, or any relevant medical documents, old prescriptions, discharge papers ready. When the medical personnel arrive, calmly provide them with information about the onset of symptoms and what has happened. Don't forget to inform the patient's family members. These life-saving actions are crucial for effective emergency care during a cardiac event. A heart attack doesn't give you a second chance. The first 70 minutes from the onset of symptoms is the critical time frame that determines your survival and quality of life thereafter. Every minute that passes, millions of heart muscle cells are irreversibly destroyed. The longer the delay, the lower the chances of survival, and the higher the risks of mortality, heart failure, and disability. When you win the 70-minute race, you give yourself or your loved one the opportunity to witness the miracle of modern medicine. When the ambulance arrives at the hospital, everything will proceed with urgency and professionalism. The patient will be taken directly to the emergency room where the medical team has been notified and is ready to act. Immediately, crucial diagnostic procedures will be carried out. An electrocardiogram ECG machine will be connected to accurately identify the location and extent of heart damage. Simultaneously, a blood sample will be taken for a troponin test, a vital biomarker that helps confirm the diagnosis of a heart attack. All these steps occur within just a few minutes, with the goal of determining the optimal and fastest treatment plan. At this point, the sole and most important goal is to reopen the blocked artery revascularization. Two main methods will be considered. 1. Percutaneous coronary intervention (PCI). This is considered the gold standard in the treatment of acute myocardial infarction. The doctor will thread a very small flexible catheter from an artery in the patient's wrist or groin, traveling against the blood flow to the site of the blocked coronary artery. Through this catheter, a small balloon will be inflated to widen the vessel, pressing the blood clot against the artery wall. Afterward, a tiny metal scaffold called a stent will be placed to keep the blood vessel open and clear permanently. This method helps restore blood flow almost immediately, saving the maximum number of heart muscle cells on the brink of necrosis and minimizing long-term complications. 2. Fibrinolytic therapy. Clot-dissolving drugs, in cases where the patient receives emergency care at a medical facility without a cath lab for intervention, or when timely transfer is not possible, fibrinolytic therapy is a crucial life-saving weapon. This is a very powerful medication injected intravenously which works to dissolve the blood clot, causing the blockage. Although not as effective as PCI, early use of fibrinolytic therapy can still reopen the artery and save heart muscle while awaiting transfer to a larger center. Both of these methods are testaments to the progress of medical science. But they only truly work wonders when the patient arrives at the hospital promptly within the golden window. We have journeyed together to understand the golden 70 minutes, a harsh yet hopeful medical reality. This concept is not just a mere slogan, it is based on the very pathophysiology of heart muscle cell death. Every minute that passes, a part of the heart slowly withers. Always remember that missing this golden window means accepting severe, potentially lifelong consequences. Conversely, timely action gives you and your loved ones the greatest chance to return to a nearly normal life with a healed heart. The final and most important message we want to convey to you for this health channel is the first and most important person who can save a heart attack patient is you. Ambulances and doctors can only be effective when you act correctly and quickly. Therefore, equipping yourself with knowledge is the most powerful weapon. Do not keep this information to yourself. Share it with your parents, spouse friends, and colleagues. A simple act of sharing today could save a life tomorrow. Turn knowledge into action because in the 70-minute race, there is no room for hesitation.